Hello, I'm Dr. Manish Singhal, medical oncologist at Apollo Hospitals, Noida and Delhi. We are presenting the ESMO update meeting. ESMO is European Society of Medical Oncology meeting, which was held this year in October 2023. This is a meeting which is attended by global experts across the world, and it provides all the up-to-date information about various cancers. And we are happy to announce that this meeting was held under the aegis of Apollo Hospital and was held on 4th of November at Radisson Blu, Sector 18, Noida. And we were able to invite faculty across Delhi NCR and all other cancer experts, which shared their views on these updates, and was attended by a lot of students. And I'm sure that these updates includes not only about breast cancer, lung cancer, GI cancers, gastrointestinal cancers, GU cancers, but also supportive care and sarcomas. It's so very important to keep up to date to provide the best possible care to our cancer patients. And I hope that you like these updates, and we will keep introducing more updates like this in the future. Thank you.
First of all, I thank Dr. Manish Singhal and Dr. Manish Singh's team for the invitation. So I'll be presenting the TROPION Breast01 study. So this study compared the new antibody drug conjugate datopotamab deruxtecan, which is a TROP2 directed antibody drug conjugate that selectively delivers a potent topoisomerase inhibitor payload directly into the tumor cell. It has got several unique properties. It has got an optimized drug to antibody ratio of 4 with a stable linker payload and a bystander anti-tumor effect. Dato-DXd had previously demonstrated promising anti-tumor activity and a manageable safety profile with a convenient 3-weekly schedule in pre-treated patients with metastatic hormone receptor positive HER2 negative breast cancer. So, TROPION Breast01 study was a randomized phase 3 open-label global study. The key inclusion criteria were patients with hormone receptor positive HER2 negative breast cancer who had been previously treated with 1 or 2 lines of chemotherapy and had experienced progression on endocrine therapy or for whom endocrine therapy was unsuitable, and those patients who had a good performance status. These patients were randomly assigned in a 1:1 ratio to Dato-DXd, which was given 6 mg per kilogram every 3 weekly, to investigators' choice of chemotherapy, which included eribulin, vinorelbine, gemcitabine, and capecitabine. The endpoints were PFS by PICR and overall survival, and the secondary endpoints were overall response rate and investigator assessed PFS. So the Dato-DXd contained in 365 patients, and the chemotherapy arm contained 367 patients. The demographic and baseline characteristics were well matched. So the study showed a statistically significant progression-free survival with Dato-DXd. The median PFS with Dato-DXd was 6.9. And in the chemotherapy 6.9 months, and in the chemotherapy arm it was 4.9 months with a hazard ratio of 0.63. And this PFS was consistent across all the subgroups, the ratio of 0.84. The study is continuing to be to the next planned analysis for OS in 2025. Regarding the adverse events, the most common were hematological toxicity, dry eyes, gastrointestinal toxicities like nausea, stomatitis, vomiting, constipation, fatigue, and alopecia. The specific side effects for Dato-DXd were oral mucositis and stomatitis and ocular events, which were mild, and ILD rate was very low. It was mainly grade 1 or 2. So, in conclusion, TROPION Breast01 study demonstrated that Dato-DXd, the new antibody drug conjugates, it provided a both improved efficacy and safety compared with the chemotherapy for patients with hormone receptor positive HER2 negative disease in later lines. This study has met its primary PFS endpoint, demonstrating statistically significant clinically meaningful improvement in PFS with Dato-DXd compared to chemotherapy arm. And this PFS benefit was observed across all subgroups and there was a higher overall response rate with the Dato-DXd, and there was a trend towards an improved overall survival with Dato-DXd. And regarding the adverse events, most were grade 1 or 2. Patients receiving Dato-DXd had fewer grade 3 or more adverse events, as well as fewer adverse events leading to dose interruption or reduction compared with chemotherapy. So the results are.
Thank you, Dr. Vishnu. Basically, what is the mechanism of action of this?
So this is an antibody drug conjugate similar to Enhertu, this trastuzumab deruxtecan. Antibody will be the
Yes, positive patient and
yes,
negative patient.
So it is approved. Actually, the study in both CRPR negative means triple negative and this thing is available. Hormone receptor positive, HER2 negative.
But it is not like trastuzumab.
No, not sir. It is a tropic surface antibody, sir. So it will get attached to this antibody will get attached to the TROPION antigen. Yes, sir. HER2 negative.
The study is HER2.
Similar to Trodelvy, sir. Trastuzumab govitecan. It has got a similar mechanism of action.
But the payload is different, sir.
Yes,
Payload is irinotecan, irinotecan.
SN38, and this is topoisomerase deruxtecan.
Topoisomerase.
So with this payload, we are able to attach more drug versus antibody drug ratio is higher. So more drug is delivered. Whereas sacituzumab govitecan uses monomethyl auristatin, which is you cannot attach more drug.
Yes. And actually, for sacituzumab govitecan also now the data is there, sir, for hormone receptor positive HER2 negative disease. It has got an overall survival advantage. This has got a similar mechanism of action, and mostly it will also have an overall survival advantage.
Thank you very much.
Thank you.
Thank you.